Assurance activities for bipolar disorder. In a society that has so many different things or situations developing, having onset bipolar disorder can help a person with it lead a normal or almost normal life. It is the choice of each community to come together to make sure they lead as normal life as possible. This lets the community know that there is care surrounding them. These actions give the bipolar person faith and confidence within themselves. Enforce laws and regulations that will help to protect the health and give assurance of safety for each individual. Link people to needed healthcare services to assure them that there is help available. If the help needed is unavailable, professional persons should be able to give information where help can be received. Assure the personal healthcare workforce and the general public. Evaluation for effectiveness, accessibility, and quality personnel and population based health care services should be offered on, or on hand to all interested parties. Assurance is the indication that inspires confidence, making a person feel successful and good about themselves. Assurance gives self confidence. The feeling of confidence and assurance is like no other feeling ever experienced. When a person has this feeling, it makes them feel like they are on top of the world. For a person with bipolar disorder, it makes them feel alive and full of life. Oftentimes, individuals with bipolar disorder go through periods of depression. Many of them even become suicidal. The concept of enforcing laws means to help a person with bipolar disorder restore their self confidence. This picture depicts a young man in a restraint or straitjacket. The restraint is for his own safety and to protect him. There is strong evidence linking mental disabilities to abnormalities in the structure of the brain and also in the function and chemistry within the brain. It has been said that society would benefit from increased mental health coverage. The treatments are very expensive, and if the individual could afford the treatments, it could help them to lead enjoyable and productive lives. Laws like the Americans with Disabilities Act, the Health Parity Act, and similar state laws have shown an increase in awareness of the problems of discrimination against those with mental disabilities. The Americans with Disabilities Act offers strong protection of the disabled in many areas struggling with mental illness. The Mental Health Parity Act conceives as a means of ending discrimination between physical and mental health benefits in employer provided insurance plans. It exempted the employer from raising premiums. Linking people with mental illness to needed personal health services helps to assure them of the provision of help. These programs help to improve family functions and improve positive outcomes of mental health. These provisions could also help to reduce poverty related risks. Assurance of the public and healthcare workforce of the illness will help them to function as normal as possible. Health practitioners, policymakers, community members, and industry leaders must work together in a multilateral fashion to establish solutions to this growing challenge. It helps to take preventive measures, so in the long run, it will help in the navigation of educating those who deal with this in healthcare field. The acknowledgement of bipolar disorder will help an individual to educate themselves of this growing issue through the world with regards to this disease. Evaluation of any given situation helps a person or persons to make the right decision to handle the problem. Assessing and evaluating the situation work hand in hand. The Healthcare Quality Improvement Act of 1986 was enacted in part to provide those people giving information to professional review bodies and to those assisting in review activities limited immunity from damages that could arise as a result of adverse decisions that could affect a doctor's medical staff privileges. Healthcare organizations have the responsibility to explain to their staff, patients, and families that patients have a legal right to direct their own medical and nursing care as it states law. The Patient Self-Determination Act of 1990 was enacted to ensure that patients of their rights. Bipolar disorder or manic depression is a psychiatric disorder of the brain that makes an individual have occasional mood swings. Individuals affected with bipolar disorder experience manic episodes where they enter a depressive state, sometimes mild or can be severe. In Florida, a lot of adults are known to have a history of drug abuse, mental health, and a long time life of addiction. Bipolar disorder is a chronic disease and accounts for 50% of Florida's population for low income. In middle income, it accounts for 39% and 72% in deaths. The population of Florida is 19,317,568, and there are 139,000 people diagnosed with bipolar disorder. Bipolar disorder occurs in all societies, regardless of class, color, religion, or culture. These risk factors make a person with bipolar disorder feel as if they are threatened without the sense of doing for themselves. They have the will to make it on their own, such as financial ability. Many may feel that if they are middle aged, that it is too late to achieve their goals. These are level barriers that make them feel insecure. Many adults with bipolar disorder are at high risk for suicide. Bipolar disorder can be hereditary. 80 to 90% of people with bipolar disorder have a relative with depression or bipolar disorder. Treatment for bipolar disorder involves diagnosing the problem and finding the right medication and treatment interventions for the person. Just as everything else, each person has to be treated differently. Many cases may not be as severe as the next case. Although bipolar disorder is a lifelong disease, an individual with appropriate treatment can live a normal life depending on the extent of their condition. With proper treatment, many people with this disorder can live a good life and even get a job and go to school. The more education a person has, the better they are to adapting to the disorder or to having a person to prevent further occurrence of the mania episodes. Learning to recognize potential stressors and triggers before an episode happens is an intervention method. Cognitive behavioral therapy helps an individual to learn to monitor their behavior, thoughts, and stressors. Interpersonal and group therapies are groups used to help gain insight into their management condition. These self help groups also build confidence and self esteem. There are long term and short term health facilities a person can go to for help to get better. Oftentimes, people with illnesses such as schizophrenia and bipolar disorder go untreated because many people fear the sense of belonging and feel ashamed. However, treatment of the illness in the early stages will restore the sense of security and confidence in a person stricken with bipolar disorder. Assurance is the feeling of self worth and determination to have the will to live and to live a normal life as every other normal individual. Enforcing laws and regulations helps to ensure the safety and protect health. Linking other people who can help those with bipolar disorder gives them a sense of trust and understanding through various services and organizations. This is possible. Assuring them with doctors and health professionals by taking preventive measures helps a person with the disorder be able to make decisions for themselves. Acknowledgement of the disorder is the first step of someone with bipolar disorder. Lastly, evaluating the effectiveness of this disorder will help to choose the best treatment and medications for the individuals. The PSA was passed ensuring that patients have the right to make their own decisions.